facilities. Like districts across the country, our working groups had to reimagine how schools can operate to plan for a safe and successful school year. Additionally, we receive feedback from our school communities, families, school leaders, teachers, staff, and students, as well as union members, many of whom are on the call right now. And I want to take this opportunity to thank all of those who participated in the weekly meetings as we were planning this. And I know many of these members are here on the virtual presentation this morning. And so Nicole Hunt from Local 634, Ernie Bennett, 32BJ, James Witherspoon from 32BJ, Robin Cooper, CASA, Jim Whitehead from SEIU. I want to thank Jerry Jordan from the PFT, although they may not be on the virtual announcement this morning, but I want to thank all those individuals for your assistance and for working in collaboration with us as we develop this very important set of plans. Our Advanced Education Safety Plan is just that. It is a set of guiding principles to ensure that our students and staff can return to learning and work environments that keep the health and safety as our top priority. I want to publicly acknowledge and express my sincere gratitude for those who partnered with us to develop this plan. The Philadelphia Department of Public Health, Policy Lab at Children's Hospital of Philadelphia, Centers for Disease Control and Prevention, Pennsylvania Department of Education, and the City of Philadelphia leaders. And as I indicated, many of the unions that I introduced earlier. I'd also like to acknowledge Accenture's critically important assistance. From working with districts across the country, they were able to share expertise and assist us in creating a plan that is flexible and prioritizes the well-being and health of our students, staff, and school community members, emphasizing student achievement and high-quality instruction. It should go without saying that we all want to return to school in a way that we have been most accustomed. But COVID-19 has taught us that we must
Thank you. No problem.
Monica, I think you should put yourself on mute. COVID-19 has taught us that we must be willing to adopt practices that we might not be used to, but practices that will be absolutely necessary to prevent the spread of this virus. That means everyone will be required to wear face coverings, practice social distancing, and frequently wash our hands or use hand sanitizer. We will also implement CDC recommended cleaning protocols to ensure that high-touch areas throughout all buildings are cleaned multiple times a day. And while face-to-face, socially distanced instruction will be our priority whenever possible, especially for our younger students and those students with complex needs. We will make available the digital learning options that allow for students to have quality instruction while in their own homes. Now, I must say that we are preparing for when, not if, positive COVID-19 cases impact one or more of our school communities. The unfortunate reality is that infections are still rising in many parts of the country, and there is not yet a vaccine. Therefore, we will remain in constant communication with the Philadelphia Department of Public Health and work closely with them, following their guidance regarding protocols around when to temporarily close a classroom, a school, or even the entire district and return to fully digital learning until otherwise advised. Districts across the country are facing devastating financial projections because of COVID-19, and we hope the federal government will fully support the passing of the HEROES Act to provide much needed additional funding. There is no room for politics when it comes to safely educating our children and ensuring that the professionals, the adults responsible for this work, can do so without placing their health in jeopardy. I cannot sit here and say this will be easy for any of us. We all are living through a pandemic, and there will surely be challenges ahead during these uncertain times. But I am confident that by working together, we will be able to provide our students with the education they need and deserve. And by working together, we will be able to develop solutions and as issues arise and ensure that we will all get through this safely as possible. At this time, I'm going to turn things over to our board president, but before I do think that we have one other individual who's here representing many of our unions. And I said I didn't know if someone was from the PFT. I understand Denise Rogers is here on the call. So Denise, thank you for being on the call as well. And Royce Merriweather, representing all of our school safety officers, are also on the call and has been active in assisting us even from the start in meal distribution, distributing Chromebooks and the like. So Ross, thank you as well. And so with that, I'd like to take this opportunity to turn things over to the Board of Education President, Joyce Wilkerson, who will share insight on how our Board of Education will support our work during these uncertain times. Joyce?
Thank you, Dr. Height. Good morning, and thank you all for attending our press conference today on the reopening of Philadelphia's public schools. I'd like to begin by acknowledging what a challenging time this has been for our entire school community, our students, their families, teachers, and staff. As we navigate the rocky terrain to providing an education during a global pandemic to more than 203,000 students across the city of Philadelphia, our community has been stepping up, and board members have a deep appreciation for all the hard work that's been going on by everyone across the district since mid-March, when schools closed and we shifted to online learning. Now, as the district prepares for the new school year, which will include in-class learning and digital learning, we know this hard work will only grow. We must continue to be focused on the critical mission of ensuring that all students receive an education that allows them to thrive and reach their potential in order to succeed in a 21st century world. To fulfill our mission, it's imperative to reopen schools guided by the highest priorities of keeping students and employees healthy and safe so that we can deliver high quality instruction to all students across in-person and digital environments and support our students' growth and achievement. As you know, the district is following the guidance of public health experts from Children's Hospital, the Philadelphia Department of Public Health, and other local and national leaders as we develop protocols to ensure safe and inclusive learning environments for everyone. However diligently and thoroughly we plan for the school year, though, we must keep in mind that we exist in uncertain times and will have to be flexible and nimble as we adapt to changing circumstances. Board members look forward to working collectively with everyone in our school communities to ensure that all of our children are learning, achieving, and reaching their greatest potential. We hope the entire Philadelphia community recognizes the different circumstances that families will face while balancing their need to work with the needs of their children and to learn in a safe and supportive environment. The board is deeply grateful to everyone who makes this possible. Thank you all. The board will be considering the health and safety components of this plan formally at our action meeting next week on July 23rd, and we'll share more information about this meeting on Monday. And with that, I'd like to turn it over to our mayor, Jim Kinney.
Where's the screen?
There, unmute myself.
Where's my notes? Sorry about that. Thank you, Joyce. And from the moment this pandemic hit, our administration has worked hand in hand with the school district to best serve children and families during what has been the most difficult times for many Philadelphians. Hello, can you hear me?
We can hear you.
I'm sorry.
Yeah, Mr. Mayor.
I'm just all right. First, want to commend Dr. Height and his team for their leadership in developing this plan to provide options that best meet the educational needs of our children while ensuring that adults entrusted to teach our children can do so in a safe working environment. Safety and science have guided the entire process about how our children will return to school, and it will be safety and science that will be used to implement policies to keep us safe in the midst of these challenging circumstances. The announcement of this plan does not end our work. In fact, the hard work is really just beginning. The city will continue determining what supportive services and spaces we can provide or coordinate to support students and families. And we will continue working with our partners to ensure access to reliable internet service isn't an impediment to students during their virtual instruction days. And we will need everyone else to also do their part, because together we can stem the spread of the virus by doing some very simple things. For example, we support the district's mandate for everyone to wear face coverings, everyone. Dr. Farley, who you will hear from shortly, will ensure that the Department of Public Health continues to provide necessary resources and guidance. SEPTA will be working with the district to make sure those students who rely on public transportation to get to and from school can do so in the safest ways possible. I do need to be very clear when I say that components of this plan can and very likely will change as we get deeper into the school year because COVID-19 continues to evolve. Our city has been fortunate not to see some of the terrible spikes that many cities across this country are experiencing. I believe that's because of the ways our residents have taken seriously our request to follow guidelines such as social distancing, limiting travel to essential matters, and avoiding social gatherings. It will be even more important to be smart about the ways in which we interact once students go back to school in a few weeks. If we can all continue to adhere to safety practices, including wearing masks whenever in public, we will be in a better position to reduce the spread of COVID-19. And whether our federal government develops a national plan of action or if a vaccine is available, whatever comes first, we will do our part right here at home to keep as many of us safe as possible. The sooner the threat of this virus is gone, the sooner our children can return to their classrooms 5 days a week. And the sooner parents and guardians won't have to face these real concerns around childcare and other challenges that may be associated with having our children spend some time with digital learning at home. As Dr. Haidt stated, now is not the time for threats from the US Secretary of Education or the President to keep money from districts like ours. I made it no secret my displeasure with the way this entire response, or lack thereof, to this pandemic has been handled by those folks in Washington. Unfortunately, Secretary DeVos, while demanding in-person learning only, has said that individual districts will have to figure out how to do that safely. How nice of her. This is unacceptable. But just as we have done pretty much from day one, we will work together using guidance from those who understand how to best combat infectious disease, to do what's best for our children, our families, and our city. And now I thank you very much, and please welcome Dr. Farley for his comments.
Thank you very much, Mayor. We've made real progress against the coronavirus epidemic here in Philadelphia. When it peaked in April, we were seeing about 500 to 600 cases a day. And we were testing about 1,300 people a day. The percent of people that we tested were positive was about 40%. Today, we're identifying just a little more than 100 cases a day. We're testing about 2,100 people a day, and about 5% of those people are positive. Because of the progress we've made, we're now allowing lower risk activities to take place with safety precautions. That includes retail stores, barbershops, and beauty salons, restaurants, and museums and libraries. Now, schools under ordinary circumstances are crowded, and so that's a situation of risk. And so we could just consider keeping schools closed, but for their long-term success, including their long-term health, children need to learn. And so as a society, we have to try to find a way to balance those risks. Now, one thing we know is that children clearly have a lower risk of severe infection with this virus. Now, children also may be less likely than adults to spread the virus to other people. But we have to acknowledge there's a lot of uncertainty about the risk of spread from children. So we at the Department of Public Health, specifically two pediatricians who work at the Department of Public Health, have developed detailed guidance for elementary and middle and high schools and allow them to reopen while minimizing risk. The two pediatricians were Dr. Stacy Callum, formerly of CHOP, and Dr. Susan Coffin, who is currently affiliated with CHOP as an infectious disease pediatrician. This guidance was based on their own expertise in addition to guidance from the CDC and others. Those doctors also worked very closely with the school district in developing their own plan. And they reviewed the plan, and I can endorse it as something that's an appropriate plan to go forward with. There's two key elements to this. One of them is the AB schedule, which reduces the number of children in the school to reduce that crowding at any one time. And then there are safety precautions, a number of safety precautions to minimize the risk for the children while they're there. Now, there isn't any guarantee that this will prevent all cases in the schools. Let's be clear about that. We do expect some cases of COVID to occur in children during the time that they're the school year, but we hope to minimize that. We at the Department of Public Health will work with the school district as they implement this plan. And when and if they get cases in schools or spread in schools, we'll work with them on how to address those. If it's appropriate, we will close individual schools, or if it's appropriate, we will shut down the entire system again. More generally, as you heard others say, we need to be flexible as this epidemic evolves and we learn more about how this virus behaves. But for now, though, we can be hopeful that we can open the system safely and our children can start to learn again. Thanks very much. I believe Dr. Clack is next.
Thank you, Dr. Farley. And as Dr. Height, Mayor Kenny, and Dr. Farley have all stated, the district has worked very closely with the public health experts to develop our plan for a safe return to school for both our students and our staff. We are very prepared to implement an extensive set of safety measures to promote the health environments for everyone in the upcoming school year. And those measures will be most effective when we all understand the ways to make that happen and if we all cooperate together. Our comprehensive strategy to reduce the spread of COVID-19 includes promoting good hand hygiene and good hygiene practices overall, including maintaining healthy environments and operations in the schools and providing and activating a plan when someone gets sick. At the start of the school year, we are requiring parents and guardians to sign the COVID-19 School Health and Safety Agreement that describes their commitment to keeping their children home when their children are sick and to seek appropriate medical care when appropriate. Additionally, we will work and continue to work in conjunction with our partners at the Philadelphia Department of Public Health, which we have done all along, around how to handle, as Dr. Farley said, any possible cases when they arise. And we will also work collaboratively and follow their lead in terms of regards to closures when necessary, as was just mentioned. The health and safety of our students and our staff and our essential visitors is top priority for all of us. So you can expect that we at the school district will enforce all of the following. All district employees, students, parents, guardians, and essential visitors will be required to perform a daily health screen at home to assess for COVID-19 symptoms and potential exposure to someone who was diagnosed with the virus. This questionnaire and screening will have to be exhibited upon entry for staff, but not for students. Encouraging hand hygiene and encouraging and enforcing hand hygiene in any school district building and providing access to sanitizer is one of the primary methods that we will enforce in the schools. We will promote social distancing of 6 feet in the schools, in the hallways, in the classrooms, in district buildings, and you will hear us very soon from Dr. Nunez how that will happen. We will be providing masks to every student and staff member in the district, and each student and staff member, as already been stated, will need to wear a face covering from pre-kindergarten to our oldest student and every staff member. Now, there are several types of masks that will be acceptable to wear on district grounds and in district buildings. The first type is the one that we've all unfortunately been familiar with as lay people, that the medical community has always been familiar with, which is what I call the baby blue disposable surgical mask. That will be acceptable in the schools. And keep in mind, again, we will be providing masks for every member of our community. The second type is something like this, a mask that was either made or purchased from home materials and fabrics. The third will be something like this, which is a gaiter that can be worn like a neck and brought up. I do want to stress that while this mask was made from fabric. Just coming with a piece of fabric, a towel, a bandana, a scarf covering your face will not be acceptable on district grounds. It will have to be fabricated into a mask like this. Exceptions from mask requirements will be thought about and accepted, because as we are all well aware, in the community that serves our children, that there are people, staff, and students who have either medical issues or other issues where they will not be able to wear a mask of this nature. And so the second recommendation for them will be, again, something you've all become familiar with, which is a clear face shield that is secured at the top of your face. That will be for special considerations when masks are not usable. That may include people with chronic health conditions or other issues, and that will be considered on an individual basis. Our efforts will be more effective when parents and guardians and other members of our community do their part. I like to say our 4 pillars are screening, hygiene, masking, and distancing, but really all based on a platform of community cooperation and collaboration. And so that being said, first and foremost, please stay home if you are sick or if you have been in close contact with someone with COVID. Again, for your own health, but as well as our community and our society and our great city. Please build time in the morning to really think about your health and where you stand that day, every day that you're going to come into a district building. And for the staff, again, complete your form on paper or on your phone. And for students, for parents to really think about every one of those questions. Please keep 6 feet of social distancing at all times and wear your face covering, and shield your coughs and cover your sneezes with your arm or elbow. Always practice good hygiene, which is also part of this recipe of these pillars, because as we know, it's the hands to the face that really is the entry for the virus. These are all ways for us to keep ourselves and our community healthy at this time. And it's really mostly imperative, as I continue to say, is that this is a new normal and a new culture for all. And we all have to be patient with each other and remind each other when we come in contact. Whoops, remember mask. Whoops, remember stay back here, with a smile and a sense of collaboration and camaraderie. And we can make this happen together for our entire school district. Thank you. And at this time, I will turn things over to our Chief of Schools, Dr. Evelyn Nunez, who will give you more details about what will happen inside the school day.
Thank you, Dr. Clark. Good morning, everyone. As you've heard this morning, and undoubtedly anytime when the topic around returning to schools has been discussed, you have heard that we want our students back in school. I am a lifelong educator, and I, and all of us who truly care about the well-being of our students, firmly believe that there is nothing better than having teachers and students in a classroom together. However, we also know that we're dealing with a public health crisis, and because of that, we will have to provide a teaching and learning environment that not only offers a high quality education to our students, but allows for students to learn and educators to teach in a way that keeps them safe and healthy. So after many weeks of researching best practices and consulting with public health experts, we landed on the hybrid model that still will offer high quality education with students receiving face-to-face instruction or in-person instruction 2 days a week and participating in digital learning 3 days a week. Our hybrid schedule will have students divided into 2 groups assigned by schools. For example, a school will have 1 group of students in face-to-face instruction at the school Mondays and Wednesdays with digital learning on Tuesdays, Thursdays, and Fridays. The second group, or the other group, will have face-to-face instruction on Tuesdays and Thursdays with digital instruction on Mondays, Wednesdays, and Fridays. This staggered schedule will allow us to better implement social distancing since the number of students physically in buildings will be much lower. We plan on making every effort to ensure that siblings in a household are in the same schedule as to not create scheduling or childcare challenges for parents and guardians. We will also work to ensure that certain groups of students, those in pre-kindergarten and our special education students with complex needs, will receive face-to-face instruction Monday through Thursday. Families will also have the opportunity to opt into the Digital Academy, which is 100% digital learning for all or part of the school year. We will also continue to provide Chromebooks and make them available for any School District of Philadelphia student who still needs one for online learning at home. One point I do want to stress this morning, and that is that when school starts in a few weeks, students will be assessed to help inform plans for their academic success and allow us to enable a responsive intervention as quickly as possible to decrease gaps in learning. We will make every effort possible to have as normal a school environment for our students. But we all should understand and be flexible enough to understand that the COVID-19 is creating a new normal for all of us. For example, the way in which students dine in schools will look and feel very different than our norm. Students will receive a grab-and-go breakfast in the morning as they enter school. During lunchtime, they will either sit in a socially distant seat in the cafeteria or return to their classrooms to enjoy their meals. Additionally, students will not be permitted to drink from the water fountains, but will be asked to bring their own water bottles to fill at the touchless hydration stations. We will continue to provide meals to students for digital learning days, as well for those students who may opt for the Digital Academy. As our superintendent, Dr. Haidt, mentioned earlier this morning, this plan is a roadmap, and its purpose is to help us determine how we can seamlessly deliver high-quality instruction to all students, but while doing so in a safe and healthy environment. As with every component of this plan, we will continue to monitor for any best practices to implement, since this is an ever-evolving situation. Thank you, and now I'd like to turn it over to our Interim Chief of Facilities and Capital Programs, Ms. Alicia Prince, will share details on our plan's cleaning protocols.
Thank you, Dr. Nunez. It can't be stated enough that as we work to prepare our buildings for reopening, our first priority is the health and safety of all our staff and students. And we understand that the ways in which our buildings are taken care of will play a role in our efforts to keep everyone, staff, students, and families safe. Our focus is to provide safe buildings for our students and staff, and our guidelines meet all recommendations from the CDC, Pennsylvania Department of Health, and the Philadelphia Department of Public Health. As we continue to prepare buildings for reopening, we will continue to monitor information provided by these entities for any new best practices to implement. We have developed a plan for deep cleaning and disinfecting all district buildings in accordance with best practices from these entities. Our developed guidelines outline 5 types of cleaning. The first 2 only apply to school buildings, and the last 3 apply to both school buildings and offices. The first type is summer cleaning, which includes deep cleaning and disinfecting school buildings. This work is currently being completed across the district by our custodial staff of more than 900 people. The second type of cleaning is preparatory cleaning. During this phase, the building engineer will complete an inspection of our summer cleaning task. This cleaning will occur the week prior to reopening our buildings. The third type is daily cleaning of all buildings. This will occur throughout the day when the building is occupied and is conducted by custodial staff whose cleaning follows our general cleaning guidelines. At the end of each day, prior to closing the building, buildings will be sprayed down using an electrostatic backpack sprayer with EPA-registered antiviral disinfecting spray to provide a blanket disinfection. The fourth type of cleaning, high-touch cleaning, will be done in partnership with daily cleaning in all buildings. Custodial staff will disinfect high-touch points at least every 4 hours in their designated cleaning area using EPA-registered antiviral disinfecting cleaning supplies. High-touch points include bathrooms and fixtures, door handles, doors, railings, and surfaces. This cleaning is aligned with best practices provided by the CDC. The fifth type of cleaning is specialized or responsive cleaning. This occurs when situations arise that require immediate custodial response. We have already started the accumulation of all needed cleaning supplies for all staff and students, and will continue to accumulate these materials over the coming weeks. Additionally, all of our custodial staff will be trained on the enhanced cleaning guidelines and proper use of supplies. We will have hand sanitizer stations with at least a 60% alcohol-based sanitizer mounted and maintained outside of entrances and exits, entryways of cafeterias, entryways of bathrooms, both ends of hallways, and inside of health suites. We have also developed a plan using best practices from the American Society of Heating, Refrigerator, and Air Conditioning Engineers and the CDC in order to increase air circulation in all buildings. Actions in this plan include ensuring windows are operable and secure, increased running of systems, and maintaining humidity control. Lastly, resources and staffing will be key to ensure that our facilities will be maintained in a way that keeps us all healthy and safe. We are working to fill our custodial vacancies and are also making plans to conduct training sessions for our custodial staff around enhanced cleaning guidelines and proper use of supplies. We are also increasing the number of vacancies, the number of cleaning custodial staff that we have. As with every component of this plan, we will continue to monitor for any new best practices to implement, since this is an ever-evolving situation. Thank you.
Thank you, Ms. Prince. That concludes the prepared remarks. At this time, we will open the floor for questions. Our first question comes from Mike DeNardo of KYW News Radio.
How about now?
Yes, we hear you now.
Thank you. Sorry. As I mentioned, new computer. Dr. Haidt, you mentioned that the first day of school could be delayed after August 31st for COVID training and protocols. Is that part of this plan? Do you still plan to start school on August 31st?
I believe the first day, Mike, in our plan is September 2nd. And that will provide for additional training of staff in preparation for the types of protocols we're going to need to utilize in schools.
And will teachers be allowed to opt out if they are immunocompromised, if they feel as if they don't want to go to school, they feel vulnerable?
We do have a set of procedures that are also going out to all staff members. It's also guided by health guidance. And it's just not individuals that feel vulnerable or nervous, but they will have to have some record of the vulnerability that will allow them to opt out, using your term, of the program.
And final question for me, what happens on Fridays?
Digital learning for everyone, and re-sanitizing buildings in preparation for the following week.
Thank you.
Thank you, Mike. Our next question comes from Jeff Cole with Box 29.
I'm sorry. Here I am. Commissioner, you have any idea at this point how much this is going to cost?
Jeff, are you talking to me or to the health commissioner?
I'm sorry, Commissioner. You know what? I refer to you as I am sorry.
Oh,
Superintendent Haidt, Dr. Haidt. I apologize. Dr. Haidt, you have any idea how much this is going to cost you?
Yeah, we have estimates that this actually will cost somewhere north of $60 million. Could go as high as $80 million, depending on the additional staff that we may need in order to run both of these models. But it's all going to depend on who signs up for what. And there's options for individuals to remain completely virtual. And we want to collect that information as quickly as possible to determine if, in fact, we will need additional staff in addition to the additional cleaners that we've hired, all of the masks all of the PPE equipment that we have to purchase, and all of the barriers that are being installed in schools now. So we are estimating right now, it's an early estimate of about $60 million. It could increase from that pretty dramatically, depending on whether or not we will have to hire more individuals, particularly teachers.
Again, I'm sorry, Dr. Haidt. Again, so that's 60 to 80 million. Is that on top of your school budget? So that's just extra expense.
That's correct.
And where's that funding coming from? Have you thought about where you're going to get any of that?
Yeah, I mean, we all have, naturally, we have to make requests. It's one reason we are all advocating for the passing of the HEROES Act, because that would provide additional funds for us. But we will have to utilize or lean on the modest fund balance that we have to do that. We were holding it for other things, the future shortfall, but we will have to use that more quicker than we were anticipating. I mean, we'll have to rely on more funds from our funders, but it's one reason we're advocating for the HEROES Act.
And last question, if I could, Dr. Haidt, have you now gotten a better sense of what schools, what buildings based on age, and as you talked about before, and what one of you folks has said now, what schools simply are not equipped to do what you need to be done, and kids will not be able to go to those schools?
We're still working through that process, Jeff. I mean, and Alicia can speak more to that if she wants to add anything, but that's part of the process that's happening right now. As we're getting into buildings to do that initial cleaning, we have to first see what is the issue, and if in fact we can address that issue prior to the start of school. If not, then that space will be deemed unusable.
Could Alicia weigh in on that, whether she sees buildings now that will be unusable?
Again, as Dr. Haidt said, we are still doing the assessments in the buildings right now. So we are in that phase of assessing buildings and taking stock of what we have and what needs to be done in our buildings at this point.
Thank you.
And Jeff, I may add that it's
Sure.
not likely going to be whole buildings. It could be areas of the building and I had said before, we could have whole buildings, but the initial analysis is that there are many rooms in many buildings that will be just fine, but there are others that because of the significant challenges with the age of the building and the ventilation and other things, we may not be able to use that space.
Thank you. Appreciate it.
Thank you, Jeff. Our next question comes from SHAIRA ARIAS from Telemundo 62.
Hi, can you hear me, Monica?
Yes.
Okay, this is a question for Dr. Evelyn Nunez. If we could get a little bit of what she just kind of mentioned, just translated in Spanish about the scheduling, because she says certain days are for hybrid, for online, and other days are in person. If she could just go through with that for us.
Sí, buenas tardes. Estamos planificando empezar el año escolar en un programa para estudiantes que vendrán a la escuela 2 días en la semana y 3 días de la semana están aprendiendo virtualmente. Por ejemplo, un grupo vendrá a la escuela los lunes y los miércoles, entonces los martes, jueves y viernes estarán aprendiendo virtualmente. El segundo grupo vendrá a la escuela los martes y jueves, y lunes, viernes y miércoles tendrán que aprender virtualmente también. También le estamos explicando que estamos cogiendo todos los esfuerzos, planificando para asegurarnos que los estudiantes y maestros estén seguros. Estamos planificando para durante la hora del almuerzo los estudiantes sentarse a distanciado. Estamos pidiendo que los padres manden sus estudiantes con botellas de agua para llenarlos en la área de filtración con agua filtrada, para que no tengan que usar el sistema de filtración en las escuelas. Estamos cogiendo todas las precauciones que tenemos que tener para asegurar un ambiente seguro para los estudiantes y los maestros. Gracias.
Doctora, para estar segura, los viernes todo el mundo va a tener clase virtual.
Sí, los viernes todo el mundo tendrá clase virtual y también queremos recordarles que cualquier estudiante que necesite una computadora en su casa o ayuda con el internet, nosotros estamos disponibles para asistir a los familiares.
Y por último, en cuanto a lo que viene siendo el horario, hay una preocupación de parte de ustedes de que van a haber padres que van a decir, yo me planifiqué para que mi hijo vaya a la escuela de lunes a viernes. Yo no tengo la manera de que mi hijo se quede esos 2 días más los 2 días de que viene siendo sábado y domingo en mi casa. O sea, que sería un total de 4 días en la casa a la semana, que hay padres que trabajan 7 días a la semana, 5, lo que sea. Entonces, ¿hay algún tipo de preocupación, un plan que tienen en mente para lidiar con esos padres que esto va a ser un problema para ellos?
Sí, estamos trabajando con la ciudad para ver si podemos identificar programas fuera de la escuela que puedan ayudar padres que estén en esta situación.
¿Y cuándo los padres van a saber en qué horario cae su hijo?
Para el principio de agosto vamos a comunicarnos con los padres para dejarles saber el horario. También queremos que entiendan que entendemos que hay muchos padres que tienen estudiantes en varias escuelas y estamos trabajando para asegurarnos que el horario sea igual para todos los niños que vivan en el mismo hogar.
Correcto. Y esta pregunta puede ser para ti o para quien lo quiera, pero si me lo puede decir, ¿tiene alguna preocupación usted, doctora, en cuanto al distanciamiento social? Estamos hablando de niños que uno le dice una cosa ahora y a los 3 minutos se le olvida y están haciendo otra cosa. Entonces, el estar tocándose la cara, ¿ustedes tienen un plan para estar seguro de que ellos no están más de 6 pies de distancia de cada uno? Hasta el uso de la máscara. Le pueden poner, un ejemplo, la máscara ahora y de repente el niño no la tiene puesta y tiene varias horas sin la máscara, ¿me entienden?
Sí, definitivamente, y por eso mismo es que seleccionamos este sistema para abrir las escuelas, para asegurarnos que el número de estudiantes y de maestros en el salón sean la mitad para poder manejar un ambiente seguro durante el día escolar.
Thank you, Sharia. Our next question comes from Lorraine Ballard-Moore of iHeartMedia Philadelphia. Lorraine?
Oh, I'm sorry. Let me start that again. Dr. Haidt, with this alternating schedule, there are a lot of, single parents or parents that are working who are going to have challenges, especially with young children at home. So I'm wondering if you can tell us if there's any support, any suggestions for those parents who might be having childcare issues.
Thank you, Lorraine, for the question. And it's one thing that the mayor mentioned, that this is the beginning of a lot of work that we're doing to coordinate and collaborate our efforts to ensure that we have as many options available to parents as possible during those days when children may be at home. And so we are currently working with we're going to continue to work with the city on this to look at ways in which we can collaborate to make sure that not just the city of Philadelphia, but the faith-based group and many others who may be able to provide spaces for young people and programs for young people on the days that they are digital. So that's work that we're going to be engaged with, but it's really important for us to begin collecting information about who is signing up for what. So if in fact we have individuals who are signing up for complete virtual, that's one set of numbers, which would be very different than if children or families are participating in the 2-day-a-week program or the 4-day-a-week program. So that's work that we're still doing, working with the mayor's office and the Office of Children and Families to provide as many resources as possible for families.
And my last question is, Mayor Kenney touched on it, but I wonder if you could respond to Education Secretary DeVos's demand that everyone, all school districts, bring their kids for in-person classes.
Yeah, I mean, it proves to me that it's a group that's trying to give guidance that is completely out of touch, and it's a group that up to this point hasn't provided much guidance at all. But now at the end of, I mean, now we're talking about school, and all of a sudden we're hearing guidance from that group that we have to bring all children back to in person. As I indicated before, we're going to be guided by health and safety, not politics, not ideology. And so the health and safety of our children, of our staff members are going to be what defines our approach for this, not just kind of silly talk from the department.
All right. Thank you, sir.
You're welcome.
Thank you, Lorraine. Our next question comes from Avi Wolfman Arendt from WHYY.
Hello, everybody. I had a question, just sort of a clarification question. It seemed like in the guidance, and the plan, it said that all teachers would be in school 4 days a week doing face-to-face instruction. So I'm unclear on like who's guiding the digital teaching, like for the students who aren't in school that day. Like, are there other teachers, a reserved pool of teachers available to do that digital work? It seemed like you would need more teachers potentially. I was just a little unclear on that.
Thanks, Avi, for the question. And I'll have Dr. Nunez fill in on this, or Dr. Savoy Brooks, who I think is also on the call. We know we're going to have individuals who are in vulnerable categories, and so those individuals will not be able to return to in-person instruction. In those cases, we will match those individuals up with many of the families who are also requesting to stay digital. So it gives us a natural pool of individuals that we could use for that purpose. We also are, for the first time since I've been here, we are fully hired with additional teachers that we have not placed yet. And we feel like those are individuals that we could also place inside of the digital environment if needed. But that's going to be guided by who selects that option, and then we'll be able to then match individuals who are also in vulnerable categories and cannot return to in-person instruction to those young people. We also want to make sure there's a process for individuals who enjoy that space, who are very good in that space, to actually make a request to teach in a digital environment as well. And so it's all going to depend on how many individuals are selecting and what that will entail.
My second question, I forgive me if I missed it, but I didn't see much in the plan, if anything, about testing for coronavirus, like sort of like a testing protocol. So like, is there any sort of plan to regularly test staff, or is it really just like the rest of us, like if we feel sick, we go get a test, individually from a clinic?
I know Dr. Farley and Dr. Clark are both on, and I'll have one of them respond to that question, Avi.
Oh, and Dr. Clark may want to add on that. Let me just say, in general, we're not recommending routine testing for asymptomatic people, whether that's students or staff or in other settings as well. That we look for people who are symptomatic. If there's someone who is symptomatic and test positive, there may be a role for some limited testing of asymptomatic contacts. But routine screening of asymptomatic people is just not very practical, and the information is not very helpful.
And thank you, Dr. Farley. And to add to that, I think this is also part of your question. The school district will not be doing that testing. It will be recommended, as you said, to pursue a testing site outside of the school district for testing at the moment.
Thank you. And one final question. We heard a lot about sort of this idea that the system could go all virtual again, depending on changes in the virus. One thing people have read is this idea that if the positivity test rate goes well above 5%, then, you need to consider shutting things down again. Is that the threshold, or does the school district have a threshold in mind? Like if we get to a certain level of test positivity or community spread, this is sort of like the point where we sort of switch the breaker and we go to all virtual?
As we mentioned, we will be in close collaboration with the Philadelphia Department of Public Health. So I'll let Dr. Farley comment on that as well.
Yeah, let me just say, we haven't worked out exact numbers, but the general idea is if we have high rates of community spread and we believe that the school system is contributing to that in some important way, then that would be the criteria that we would want to shut down the entire system. So we'll work out some sense for numbers for that, but those are the two concepts. High rates or rising rates in the community, and we think the school system is contributing that in an important way.
Thank you, Avi. Our next question comes from Lauren Make of NBC 10.
Hi, good morning. Thanks so much. Dr. Haidt, I have a question about what will be required of families. What will you be requiring families to tell you in terms of whether anyone in their household has had a positive COVID-19 test, or maybe even whether anyone was exposed? What will families be required to tell the school or the district?
I'm sorry, Lauren, I was on mute.
I'm sorry. Do you need me to ask that again?
Yeah, no, I'll have Dr. Clark respond to that, as it's part of our guidance in our screening that we're asking individuals to do. So, Dr. Clark.
We respect everybody's privacy in terms of both students and staff and their personal health information. It will be a collaboration again with the health department in terms of reportable cases in a similar fashion that happens with keeping people anonymous, but outbreaks, people informed about outbreaks that might happen in terms of pertussis or measles or something like that.
So I'm sorry, I don't know that I completely understand. So if someone in my household has tested positive, or if someone in my household has been exposed, do I need to tell my child's school or the district about that?
Yes, I apologize. I thought it was the flip question. I apologize for that. Yes, so part of the daily screener, one of the questions that is, recommended for everyone and supported by the CDC and other places is, have you been in close contact with someone who has tested positive for COVID-19? And if so, you need to stay home for a certain amount of time, which is delineated in our procedure. Does that answer your question?
And that's for teachers and students?
Yes, I really see this as a whole community.
Okay. And this goes to, I think what you all just addressed regarding testing. And I know Dr. Farley said they're not recommending routine asymptomatic testing, but will you have people at each school who are responsible for screening or doing those check-ins with people? Who's going to be responsible at each school for making sure that everyone's healthy?
I'm happy to answer that again, Dr. Haidt. Yes. So there is, again, we are in a unique position because we have adults and students, and therefore the employee health services and employee services will be in charge of the adults, and the student health services and the certified nurses, school nurses will be overseeing the health and safety of the students. And I am part of that team.
Okay. And then last thing, and this is for Dr. Haidt. You addressed the issues with the Secretary of Education and some of the directives that are coming from the Trump administration to have fully in-person classes. Do you expect that there will be any consequences for your decision not to have fully in-person classes? And if you lose money over that, what do you do?
Yeah. So first, we're going to be guided by health and safety, and this is too critical of a decision for individuals to just be posturing around getting everybody back into school. I think 2 points here that are really important. One is that the smallest amount of funding for us comes from the federal government. And those monies come from Congress, not from the White House, not from the Department of Ed. And it comes through statutes and regulations that are legislated, not regulated from the administration. And so there's a lot of talk about funds being withheld for various reasons, but quite frankly, they're statutory guidance that comes out of Congress that will direct those resources and allow us to distribute those resources. But a little less than 10% of our budget comes from the federal government. And so naturally, we need that money. We need those monies, but by the same token, not willing to put children and adults and staff members at risk because we have individuals who are saying people just need to come back just because.
Thank you.
Thank you, Lauren. Our next question comes from Kristen Graham from the Philadelphia Inquirer.
Good morning, all. I wanted to follow up a little bit on Avi's question about the teaching force. I understand that the teachers who have been hired but not placed may be kind of the core of the digital teaching for families who opt into 100% virtual. I'm wondering what happens with most of the students who will be in school 2 days a week. On the days when they're supposed to be remote, who will be teaching them, since conceivably their classroom teachers will be teaching other students?
Yeah, and thank you, Kristen, for that. And Dr. Savoy Brooks is, I believe, still on the line. And if not, I know Dr. Nunez could also respond to that question.
I'm here, Dr. Haidt.
Yes.
Good morning, everyone. The way that the instructional model is developed, teachers will still provide every student with standards aligned grade level instruction. We will have opportunities during the remote days for peer collaboration and project-based assessments. Students will still be able to engage in small group instruction with the teacher while he or she is in the classroom, just in small group instruction, not direct instruction. Students will also have assigned tasks, independent tasks and group tasks to complete during the remote days that are aligned to what happened during the face-to-face time. In addition to that, special education teachers and teachers of ESOL will still support students in small groups during the digital days.
Great, thanks. My next question is about student attendance. When the district went emergency remote in March and began resuming instruction, students were basically marked present if they made some kind of contact with teachers. Is that going to continue to be the case, or will they need to meet certain work standards to be considered present?
Kristen, thank you for that question, a really important question. This is completely different than enrichment and review, and that's what we were doing at the end of last year. Now we're talking about introducing new information, new skills, and it will be a requirement of young people to engage on a daily basis in order to be counted as present. And work will be graded, and just as you heard from Dr. Savoy Brooks, there will be assignments on days when children are there and assignments on days when they're not. So it will be something that's very different now, and that's why it's so critically important for us to we're working to ensure that all children who need a Chromebook will have one, but we're also trying to resolve, and we are getting much closer to resolving the internet access issue as well.
One question about substitute teachers. How do you plan to handle when teachers might be absent for whether it's COVID or a regular illness? Do you anticipate having trouble filling substitute vacancies, especially at some schools that traditionally have trouble attracting substitutes?
Yeah, I mean, I think that's in the guidance that we're releasing today for all staff members as well. Naturally, we're going to have substitutes, and we will still have substitutes for children in both digital and in person. And we're going to use the same process that we've used in the past, but with this time, that being a digital plan or in-person plan. And so many of the plans take that into account, but many of the substitutes are still a part of Kelly Services who we use, and we will still have that resource available.
And so I'm just wondering, when you talked about costs for hiring additional staff, are you talking about hiring additional teachers as well?
We may, and it's going to be based on who signs up for what, right? So because everyone has the opportunity to go completely virtual, we want to first understand what we have and what's going to be needed, and we could very well need to hire more teachers. I know New York had talked about needing to hire several thousand teachers to implement their plan. I think the number was 4,000 to be exact. And so it is, we're thinking through that, but we want to be informed. We don't want to estimate that. We want to be informed by who is selecting which model. I'll also add that we are anticipating hiring more subs as well, or needing more subs, not hiring more subs.
Great, thank you very much.
You're welcome.
Thank you, Kristen. The next question comes from Jacqueline Lee of 6ABC.
Unmute. Testing. Good. All right, Dr. Haidt, we just have some questions from our viewers. Can you kind of explain what is the point of only doing 2 days in person, 3 days virtual? Why not just do all in person 5 days, or all virtual?
Well, Jacqueline, I mean, primarily because of the guidance that we're receiving from the health department. In order to maintain social distancing, we can only take a percentage or portion of our populations in schools at one time. And so that's why we could not do the five days completely. We did look at, and I think this is in the plan, we did look at both trying to bring back, we started with trying to bring back pre-K through 5th grade and making sure all of those students had an in-person experience. But then it was too cost prohibitive, and we would need thousands more teachers to do that. Then we also looked at bringing in pre-K through 3rd grade. And once again, it became too cost prohibitive in order to hire the number of teachers, even if we had those teachers available, which is a big question this time of year. And so we looked at that and decided we could not do either of those. So in order to implement the distancing guidelines, in order to implement the safety protocols, we had to reduce the populations, and that's why it's 2 days a week as opposed to each day of the week.
Is there a reason it wasn't all virtual?
Well, yes, there's a primary reason, and because children need face-to-face instruction. And that was the one thing that we heard from all of the experiences that individuals had since we went out on March 13th, that there's still a need for children to engage with adults and with teachers. And that's the reason why we didn't start with all virtual, although we're providing that option for any family member who wants to take that option.
Forgive me if this was answered already, but what are the options for teachers or staff who are not comfortable going back in person?
Yeah, to remain digital, they will be able to actually be a digital instructor. But once again, it's just not you just can't say, I don't feel comfortable. It has to be some sort of documented medical reason that those individuals are either vulnerable or in vulnerable categories or have others in their home who are in vulnerable categories. That guidance is being shared in documents that we're sending to all staff today as well.
Thank you.
And then, can I ask one more question?
It's the last question. We do have to move on.
Yes, thank you. And what is your advice for parents who work full-time who might not be able to accommodate this hybrid schedule?
I don't know. It's one reason. I mean, look, we know that this is difficult for everyone, and we are trying to do our best and to make sure we're providing an opportunity for children to engage in instruction and engage in learning this year. So we know it's going to require sacrifices from a lot of individuals, but it is, once again, it's why we kept the virtual option there for families to take if in fact they feel like that's a better option for them. In addition, we hope to be able to announce later through collaboration with the City of Philadelphia opportunities for other places to host children and programming in the event that they are on a digital day, not an in-person face-to-face day.
Thank you.
Thank you, Jacqueline. Our next question comes from Natasha Brown of CBS 3.
Okay, sorry. Can you hear me now?
Yes.
Hi. Okay, this is just for Dr. Haidt. Just wondering, just on any given day, on those in-person learning days when kids are coming into the schools and coming into the classrooms, what's your idea of like controlling the amount of kids that are going to be in a class or in the building at one time? What are the parameters surrounding that?
Yeah, so a couple of parameters, Natasha. One is that we'll have desks that are already arranged at 6 feet. And we will have signage in schools where we don't want children any closer than they need to be. You heard about the cleaning protocols that we're going to be taking with the high touch surfaces as well. They will be grabbing meals and having those meals in their classrooms. And even if that's not available, the cafeterias will be arranged so that children are seated 6 feet apart as well. And as was indicated earlier, everyone is required to have a mask, and those things that we will provide if children don't come with those. And those are both students and adults, in addition to the self-screening that we're asking everyone to do. So those are some of the things that we're doing. And as you heard from Dr. Clark, it really is going to become an effort of all of us to talk about the importance of mask wearing, of social distancing, of hand washing and using sanitizer. It's going to be all of those things that are really important. It just cannot be the school trying to enforce that. We all have to promote that.
Okay. Thank you very much.
You're welcome.
Thank you, Natasha. We do have a few more questions, so we ask that you, we appreciate your patience, and we do have to limit questions, just one outlet per question. So if your outlet has already asked a question, unfortunately, we cannot take your question during the rest of this conference. Our next question comes from Maritza from Aldea.
Hi. Can everyone hear me?
Yes, we can hear you.
Okay. I wanted to know if a teacher tests positive for COVID, will their leave be paid past their usual sick leave, like the 2 weeks that they need to quarantine?
I think we may have our chief of talent on who can respond to that question.
Good morning. Yes, so the answer, there is a federal leave, the FFCRA leave, that can apply in this situation that goes above and beyond individual sick leave. So they, for individuals who test positive, there is a specific leave that is related to that, as well as use of sick leave, depending on how long they are out for.
Okay, great, thank you.
Thank you, Maritza. Our next question comes from Jessica Press with the Philadelphia Citizen. Okay. Our next question comes from Dale Mezzacapa with The Notebook.
Good morning, everyone. Dr. Haidt or anyone else who is in a better position to answer the question, I'm trying to get a sense of individual schools and how they are going to decide various things relating to, you know, which students and which teachers, and are they going to have to come up with a plan and identify students for which days by a certain time? I guess there's a certain deadline for, you know, how many classrooms they have that's usable. I'm just wondering if someone could explain in a little more detail what individual schools, what parents and families can expect to hear from their individual schools between now and September 2nd.
Thanks, Dale, for the question. I think Dr. Nunez has been working with schools on this issue. And so Dr. Nunez, if you could respond to the question.
Yes, absolutely. So the next step after the release of this plan, the assistant superintendents are working closely with school principals to look at all the guidance that we have provided. And we're now at the time where we are developing school level plans for reopening. We are also working on defining the groups of students that will be partaking in face-to-face instruction on Mondays and Wednesdays, and the group that will be attending school for face-to-face instruction on Tuesdays and Thursdays.
And, this is going to look very different for elementary schools, because right now class sizes are, we all know how big they are. Is there a limit to how many kids can be in one classroom at any one time?
So we are currently looking at scheduling and staying within the range of 40 to 50% of the class size. So we're looking at anywhere between 12 to 15 students in a classroom.
Okay, and just one other quick question. Dr. Haidt, you did briefly mention the state of internet access, and I'm wondering, you say that there are improvements. I'm wondering if there is any update on how you might characterize your confidence that every family and student who needs it will have it.
Yeah, so we're continuing to work with the city, Dale, and the city has been very helpful in us working with many of the providers, not just to talk about who has and who doesn't have, but really trying to solve the complex problems associated with this. And so I wish I could say more, but that is moving nicely. And I want to thank the city for their help with many of the providers who are now trying to help us solve this problem.
Is there going to be some kind of further announcement within a defined period of time relating to this?
I'm anticipating that, yes.
Thank you, Dale. This concludes the press conference, and we thank you all again for your patience. If you have additional questions or need more information, please do not hesitate to reach the Media Relations Department via email, text, or phone. We thank you again for your time and wish you all a very peaceful day.
Thanks, Monica. Thanks, everyone.